At the moment, we're in Ladbroke Grove, the heart of Ladbroke Grove, and we're looking at the Westway structure that cuts through the whole of North Kensington. I thought I'd come and bring you here to see one of our main structures of pollution. It has Old People's Community Centre, it has a prep school here. So yeah, we try to do a lot with something that is a poisonous stature in our community. So I am asthmatic severely, my daughter is asthmatic severely. My mum was a teacher and she supported and was deputy of a nursery school under the Westway, further down near Latimer. So I thought it was a good idea that my daughter then would join her while I went back to work in the city. My daughter's health deteriorated to a point that she was hospitalised. Had I known that it was the motorway that was contributing, the nitrogen dioxide that was contributing to her physical demise, I would have pulled her out and I wouldn't even want my mum there.
We're currently on the rooftop of an air quality monitoring super site on Marylebone Road, one of the busiest roads in London. And we have equipment here which is measuring every pollutant that's emitted from the vehicles we're passing by. It's actually opposite Madame Tussauds, and you can see here there are hundreds of people queuing to get in there every day, including a lot of children. And this happens to be one of the most polluted roads in London because of the very high traffic volumes. So what I'm holding here is a side pack which measures the tiny particles which we call PM 2.5. They're so small you can't see them, but they're being emitted from all the traffic, from the emissions and from the brakes and the tires that are going past us. And at this point in time, the reading is 20 micrograms per meter cubed. Now, the WHO says that the annual guideline for this pollutant is 5 micrograms per meter cubed. So we're breathing in 4 times what the health guideline is, and that's because of all this traffic.
Air pollution has a significant impact on children's health in particular. You're more likely to get infections, you might have exacerbations of asthma, so it impacts them throughout their life, so it translates into adult health as well. So children that live in areas of high air pollution when they're growing up, they never reach their full potential of their lung function, which means that in later life you're more likely to have things like worse asthma and potentially an impact on your life expectancy as well. Families from more deprived and disadvantaged backgrounds have to make really difficult choices. They have to decide where they spend money, and whether that's housing or transport or food. But they're also often the ones that have less ability to move. So they are maybe in social housing that's been provided for them, and then outside their social housing provided property, they have significant levels of air pollution. So they're getting a double hit.
We really need to look at what do we want as a society. We want our children to be going to school, living healthy lives, and not suffering from lung problems in their 30s and 40s just because of the lottery of where they were born. Air pollution has become much more important in our lives since my second child was diagnosed with lung problems. So my child has had so many days off nursery sick. I can't go to work as a doctor because my own child is impacted by the air quality. On a daily basis, I really wish that I didn't have to think about air quality, but unfortunately with my son's health problems, I do. I'm thinking about what activities we're going to take part in, even broader when we're going on holiday. What's the nearest hospital like? Is the A&E going to be able to see us in good time? But at the same time, there are some things that even as a parent, you have no control over. And that's where we turn to asking people in positions of power to see they can do things to improve air quality in your area.
It makes me feel really angry, and I think people have a right to feel cheated because they're brought up in conditions like you wouldn't breathe or drink dirty water, so why have we normalised breathing dirty air? I think the problem growing up in London with pollution is something that you can't really see, and the reality is there are so many young people, particularly those of ethnic minority backgrounds, who've done the least to cause the crisis, but who are paying the price for something that they didn't cause in the first place. So we've done some really important work with Imperial, particularly around trying to understand live data around how we can inform our air quality policies, which has actually led to us cleaning London's air, particularly through the introduction of the ultra-low emission zone.
Evidence-based policy is central to what's been happening here in London. First of all, we had the data which told us we had an air pollution problem, such as coming from this location. Secondly, we identified where the major sources of that pollution was coming from, which was diesel traffic. Then the third thing was we actually had the studies which showed us that those people who were being exposed to more of this pollution were having more health problems. We knew where it was coming from. We just needed the legislation introduced to do that. And the final piece of that jigsaw then is we had to move to the ultra low emission zone. And across that period of time, under the direction of the GLA and the Mayor of London, air quality in London has improved dramatically.
To give you an idea about the impact that ULEZ is having here in London, when the Mayor of London first got elected in 2016, experts told him it would take 193 years for us to clean London's air in legal limits. We've achieved that in just 9 years. In 2024, NOx emissions were down by 36%. In contrast, if we didn't have ULEZ, it's helping transform the air quality that Londoners are breathing every single day. And we're taking a number of different measures to make sure that we're helping improve air quality alongside the ultra-low emission zone. This includes nearly 3,000 electric buses that we have across our city. We've nearly fivefold our cycle highways across our city, 26,000 electric vehicle charging points across our city. Our black taxi fleet, over 72% of those are zero emission capable, but also what we're doing in the construction industry as well. We're removing a lot of machinery that previously didn't conform to our air quality standards to much more cleaner forms of machinery. Again, a much more holistic approach on how we can improve London's air quality.
So for the sources of pollution in any city, but particularly here in London, traffic is obviously the main source. But in addition to that, we have home heating systems, which obviously based a lot on gas burning. And then the third area, which we're getting more worried about, is commercial cooking, simply from their gas stoves, which are running a lot during the day and night, but also from charcoal burning, from wood burning. All these commercial restaurants are producing a lot of pollution, which I think we will need to control better. So the network has developed in respect of numbers of pollutants, but even that is not good enough because there's big gaps obviously between those monitoring sites. We wanted to increase the density of our monitoring to help us understand the granularity of the pollution that we're breathing in London. We really wanted to get the community involved. So we wanted to move outside our ivory tower and actually get the ordinary man and woman on the street interested in pollution, understanding why we need to measure pollution and what that pollution may be doing to their body or their children's body.
We are currently in St. Stephen's Primary School, which was my old primary school, which I left in 1984. And the reason why we're here is because I'm partly partnered up with Imperial College, and we are doing pilot schemes in terms of getting display monitors inside schools so children can understand how they work and what they do and what they can tell in terms of air pollution. The reason why we looked at putting sensors into the schools is because I felt that children are our next champion investigators. And if we don't bring them on board now, then we're going to lose a whole generation, especially because air pollution is very academic when they're speaking about it. We need it in layman's terms so that everybody else can understand it and be a part of the solution to the pollution.
So one of the most important aspects of air pollution is really on children's health. And we were able to show that here in London when we actually recruited 20 different schools and we give them the ability to measure their air pollution. And what we found was when we compared the size of those children's lungs with those of children outside London, they were smaller in volume. The next thing we wanted to do was we wanted to measure their exposure to air pollution 24 hours a day, not just at school or going to school. And to do that, we developed this. Now this is a backpack which we give to the children, but it's a special backpack because it measures air pollution. And this was with them all the time. And what we found was when we looked at the data from this backpack, it wasn't just the school journey which was the problem. It was actually what they were breathing, many of them at home in the evening when mum and dad were cooking the evening meal. And that's because a lot of the children's families had gas for their cooking source. So we don't have to just solve outdoor air pollution, we also have to improve people's quality of breathing indoors. And that will be through various interventions and education.
I really wish that air quality got the same attention that so many other aspects of environmentalism do. I think the fact that you can't see it doesn't gross people out the same way that poor water quality does, for example. But it is so important, and the data are so clear now. I think improving air quality is something that would make all of us happier. It would save money for the NHS, giving us longer, healthier lives.
Look, as someone who grew up with asthma, I know the impact that this has on so many Londoners. And so for me, a big part of this has to be around social justice and actually making sure that some of London's most deprived communities are actually seeing the benefits of cleaner air. And it's about, living in a city where people are able to enjoy their outdoor spaces without having to worry about seeing alerts or their lungs being polluted. It's about being able to go out and enjoy your time with your friends, your family, enjoy things that we should all have access to, and it shouldn't be a privilege.